What causes fluid accumulation leading to thyroid cysts? Imagine a tiny bubble forming inside your thyroid gland, filled with fluid. That's what a thyroid cyst is. These cysts develop when fluid builds up within abnormal growths called nodules in the thyroid. The main reason this happens is because of changes in benign thyroid growths known as adenomas. These are overgrowths of normal thyroid tissue that can sometimes break down or degenerate over time. When parts of these adenomas start to die or weaken, they can create small cavities filled with fluid, turning into cysts. Several factors influence how these cysts form. One key factor is the presence of thyroid adenomas themselves. While we don't fully understand why adenomas develop, they are common benign growths. As they grow larger, some areas may undergo cystic degeneration, which means they change from solid tissue into fluid-filled spaces. This process is often linked to tissue breakdown or necrosis, which is cell death caused by damage or degeneration within the nodule. Chronic inflammation of the thyroid gland also plays a role. Conditions like Hashimoto's thyroiditis, which is an autoimmune disorder, or subacute thyroiditis caused by viral infections, can damage thyroid tissue over time. This ongoing inflammation can lead to the formation of nodules, some of which may develop cystic features as the tissue breaks down and releases fluid. Iodine deficiency is another factor. When the body doesn't get enough iodine, the thyroid can enlarge, forming a goiter, and develop multiple nodules. Some of these nodules can undergo cystic changes as part of their natural progression. Although iodine deficiency is less common in countries with iodized salt, it still remains a recognized cause in some regions. Other influences include age, as older individuals tend to develop more nodules. Lifestyle factors like smoking, obesity, and exposure to radiation can also increase the risk of nodule formation. These nodules, if they undergo degeneration, can become cystic. The fluid inside these cysts is usually the result of tissue breakdown or cell death within the nodule. When cells die, they releases their contents, and fluid accumulates in the space created. This transformation from a solid nodule to a cyst is a natural part of the process, often benign. However, it's important to monitor these cysts because, in rare cases, they can be associated with malignancy or cause symptoms by pressing on nearby structures. In summary, fluid buildup leading to thyroid cysts mainly happens because of degeneration within benign thyroid nodules, especially adenomas. Factors like chronic inflammation, iodine deficiency, age, and environmental exposures can promote nodule formation and cystic changes. While most thyroid cysts are harmless, regular medical evaluation, including ultrasound and thyroid function tests, is essential to ensure they are not causing problems or hiding more serious issues. If you notice any swelling or symptoms, consulting a healthcare professional who specializes in thyroid health is always the best step.